السلام عليكم. عن الدكتور يوسف محمد قهرمان، أخصائي جراحة صدر وقلب وأوعية دموية، تدريسي في جامعة الكتاب، كلية تقنية. نبدأ محاضرتنا إن شاء الله اليوم بسم الله الرحمن الرحيم عن الثوراسيك اناتومي اوفرفيو. بداية أطلب من حضراتكم رجاء التزام بالهدوء وعدم إحداث ضجيج أو ضوضاء أثناء المحاضرة. إذا أحد عنده أي مشكلة أو شيء يقدر يأجلها لنهاية المحاضرة، أو إذا عنده حالة طارئة ويقدر يغادر القاعة بهدوء إن شاء الله. المواد المستخدمة أثناء تقديم المحاضرة هي السبورة الإلكترونية، السبورة الاعتيادية، الوايت بورد، وعندنا الداتا شو، بالإضافة إلى اللابتوب and we have other things like PowerPoint and Google Form, Google Classroom, and also we have the Mentimeter for the questions and exam إن شاء الله. بالإضافة إلى بعض الأنشطة الصفية. نهاية المحاضرة نجمع الأوراق وراح تكون عليها تقييم نهائي إن شاء الله. اليوم راح أشرح لكم عن thoracic anatomy. بداية عندي سؤال بسيط لكم اللي هي What are the components of the thoracic cavity؟ يعني كتشيست أو thoracic cavity شنو الكومبوزيشن مالته؟ من شنو متكون؟
متكون من البون، المصل،
تمام.
والفيزرا.
تمام. بعد؟
عندنا
العفو دكتورة. thoracic wall, yes, excellent.
عندنا الهارت واحد من الهارت.
Yes, and?
Inside the mediastinum there is thymus, aorta, lymph node.
Yes,
all
yes.
structured inside the mediastinum.
Yes, excellent. And we have the lungs. بعد structure كلش مهم.
aorta. المين veins arteries.
من أداهم. lungs من أداه. اللقمة اللي ناكلها وين تروح؟ through the esophagus اللي يعبر للchest to the eye. So it's composition of bony skeleton, and we have the muscle in between them surrounded by the pectoralis or chest wall muscle, and we have the pleura inside it. Inside the pleura we have the lungs, the heart within the pericardium, the mediastinum, and we have the thymus gland. Posterior to them all we have the esophagus. These are the components of the thoracic wall. So it's important to know about it. Yes, of course it's important. It's very important because there you can see there is no trauma or RTA in this country or this city without chest wall. Yeah, rarely you can see a case without chest wall trauma. So, learning objective: identify, introduce essential components of the thoracic cavity. Okay, it's important to know what are the components of the thoracic cavity. Functional relationship between thoracic structures: the lungs on both sides, the thoracic cage outside the lungs, and we have the heart in the center, and the esophagus posteriorly. Why? Because it can guide me throughout the treatment of the patient, and understanding the thoracic anatomy through interactive learning and basic clinical application in other lectures. Behavioral objective: identify major structure of the thoracic wall, as you said, Doctora, and the lungs, heart, and the mediastinum. It's important to know the components and its relationship and the function, clinical relevance of the pleura, because it's very, very important to know and the pleura and the tracheobronchial tree, and arrangement of the nerves and vessels, and knowledge interpretation in thoracic clinical cases in other lectures inshallah. تارجت اودينس السادة الأساتذة التدريسيين في دورة طرائق تدريس مركز التعليم المستمر جامعة كركوك، التخصص الطبي الدورة الرابعة. أهلا وسهلا بكم جميعا. thoracic wall أو هذا ال components we have 12 ribs, pairs of ribs, the sternum, thoracic vertebrae with intercostal muscles and nerves. إذا نجي نرسمها هنا thoracic cage، عفوا هذا ما يكتب، ما جاي يكتب. We have ribs, okay, 12 pairs of ribs, okay. The vertebral body posteriorly located, and we have the sternum anteriorly. فإذا نشوفه راح يكون عندنا thoracic cage composed of the thoracic cage composed of the sternum anteriorly, the vertebral body posteriorly, and the ribs in both sides. It resembles a cage. Actually, it resembles a cage. This prevents a blow or trauma or anything to hit the heart or the lung, the vital organs within the thoracic cavity. This is very much important because it will prevent any trauma to reach the heart or the mediastinum or even the lungs, or at least decrease it. So, I have a question. How many true ribs are there? Actually, please scan this QR code and send your answer to me. How many true ribs are there? Actually, we have 1, 2, 3, 4, 5, 6, 7. These 7 are true ribs. They have attachment to the vertebral column posteriorly, and we have attachment to the sternum anteriorly. These are called true because they have both sides attachment, while the 8th, 9th, 10th are false ribs because they have attachment to the 7th rib, which in turn attach to the sternum. These are false ribs. And we have the 11th and 12th. These are called floating ribs. Pleura and pleural cavities.
Is a closed serous membranous sac into which the lung invaginates. This region is called the hilum. There are 2 layers of pleura, the visceral and the parietal pleura.
Okay, pleura, if we take a look, if we have, this is the chest wall, we have this is the parietal pleura, which is attached to the chest wall. And we have the visceral pleura, which attached to the lung. Okay, this is the lung. This is the lung, and this is the pleura. This is parietal pleura, this is visceral pleura. In between, we have a small amount of fluid. This fluid allows smooth movement of the pleura over each other in the process of respiration. And this is why we can have inspiration and expiration smoothly without problem. Okay? So, parietal pleura located outside, while the visceral pleura located inward. My question is, do you think that the pleurae are painful or painless? Can you please scan the code and answer my question? Actually, yes. The pleura is the most painful organ in the body. You can say it's more painful than the pain of delivery. Okay? It's very painful organ. So, if anybody of you heard about pleuritic chest pain? Pleuritic chest pain prevents the patient from respiration even, but the need for respiration make the patient to withstand the pain and take inspiration or expiration, and this will lead him for shallow breathing. Now, lungs and bronchial tree. After we finished the chest wall, the pleurae, we have the lungs and trachea and both bronchi. We have the right lung, which have 3 lobes. The left lung have 2 lobes and a cardiac notch. And the bronchi, we have the trachea, main bronchi, and then we have second order division, third, until we reach 6 order divisions. And this is the last where the bronchoscope can reach, actually. And we have until it reach our respiratory bronchiole and respiratory alveoli. So, I have a quiz. Interactive quiz actually. Identify the lobes from the bronchial tree. If we make this is the trachea and this is the carina. Okay? Is it clear? Yes. This is the trachea, composed of tracheal rings, which is C-shaped cartilaginous cartilage, and the bronchi composed of complete rings, O-shaped cartilage. Okay? So, in the right side we have how many lobes of the lung? 3 lobes in the right side, yes. While in the left we have only 2. So according to that, we can have 3 bronchi in the right and 2 bronchi in the left. If we take a look at this picture, this is the first, second, and third, while in the left side we have first and second. So, according to that, we have the upper lobe, lower lobe, superior lobe, or upper lobe, right middle lobe, and right lower lobe. Okay. This is the trachea, which is divided in the carina into the right main bronchus and left main bronchus. The left main bronchus divided into the upper lobe bronchus and lower lobe bronchus, while the right side divided to upper lobe bronchus, then continue down as the bronchus intermedius, and divides again to give the middle lobe bronchus and lower lobe bronchus, and continue in division until 6 divisions. Then, after finishing the lung and tracheobronchial tree, actually every subject in this need about 4 to 5 lectures, okay, to describe, but this is an overview. Okay, mediastinum. The mediastinum is divided into 4 parts. Okay, a small area. The mediastinum is a small area, but divided into 4 parts. Upper mediastinum, and we go down. This is the upper mediastinum, and this is the down. Anterior mediastinum, middle and posterior. Upper, anterior, middle and posterior. So, it contains the heart, the trachea, esophagus and thymus gland. All these are components of the mediastinum. Actually, I have a question. نشاط حضوري راح يكون داخل القاعة. أتمنى من حضراتكم السادة إنه كل واحد يكتب لي اسمه وتخصصه. Which part contains the heart in the mediastinum? Which part of the mediastinum contains the heart? تكون الإجابة على الورقة حتى نرفع. زين نقدر نسمع آرائكم. Yes. Anterior part. لا. Posterior part. Anterior.
Anterior part or middle part?
حدد إجابتك. So, actually, because it's the most important or vital organ, it is located within the center. Okay, the center of the thoracic cage or thorax. So this is the middle, this is the anterior, this is the middle. The yellowish is the middle. The heart, because it's the most vital organ, so it's located within the middle mediastinum. This is why. And
دكتور انت شرحت لنا على الثوراسيك كافيتي والميدياستاينم هم نفس الشيء، يعني هو الميدياستاينم هو نفس الثوراسيك كافيتي والبارتس مالته يعني شويه ما لحقت افهمها، اذا توضح لنا اياها.
تمام. احد عنده سؤال شيء اخر؟ شفت يا من سؤال دكتور محمد؟
دكتور لو يعتبر الميدياستاينم هو بارت من الثوراسيك كافيتي ولا لا؟ الميدياستاينم هو ورك يعني خلينا نقول جوب مالته انه بروتكشن اوف ذا هارت اند فيزرال وبس.
تمام تمام.
دكتور العفو، الثوراسيك كافيتي يعني المين فانكشن لها فقط بروتكشن؟
ثوراسيك كافيتي. راح نجي على الأجوبة على أسئلتكم واحد واحد. بالنسبة للثوراسيك كافيتي، دكتورة جاوبت إنه ثوراسيك كافيتي اسمها مبين كافيتي. Okay, it's a cavity. So its function not, but its location and the content, it protects the content of it. Okay, the chest wall and the muscles protect the lungs and the heart or the mediastinum from trauma or anything else. Okay, and دكتور مراد بالنسبة لسؤالك الميدياستاينم not protection, it's a cavity, mediastinal cavity. So its content are the esophagus in the posterior mediastinum, the heart within the middle mediastinum, and we have the thymus in the superior anterior mediastinum, with the great vessel within the middle and downward, sometimes to the posterior. We have a lot of lymph nodes and fat pads within the mediastinal. And دكتور محمد بالنسبة لسؤالك إنه الثوراسيك كافيتي والميدياستاينم it's not a single space, but it's continual space, but not single space. We have the right lung with its pleura and function, the left lung with its pleura and function, and the mediastinum with its content. So each one has its content and its function. They have some continuation which is with each other, but separated by thin layer of membrane, which is called mediastinal pleura. Okay. Any other question? The heart and the great vessels. We have a rule of 4. We will talk about it after the video. If we take a look, 1, 2, 3, 4. 1, 2, 3, 4. We have rule of 4. Okay? Okay, rule of 4. 4 chambers. Left atrium, right atrium. Left ventricle, right ventricle. 4 chambers. Then we have 4 valves. The pulmonary artery, the pulmonary valve, the aortic valve, the tricuspid valve, the mitral valve. 4 valves. And vessels, we have 4 great vessels. The aorta, the vena cava, the pulmonary arteries, and we have 4 draining veins to the left atrium. So we can say it rule of 4. Okay. I have an assignment for you, please. Can you write this question and answer it? Write a small paragraph about the valves of the heart. ما تكتبوا لي على ورقة الإجابة مختصر عن الصمامات اللي بالقلب، بشرط تكون بخط اليد وعلى ترفع على منصة جوجل، بس لازم يكون من بحث علمي مع وضع DOI of the research، لأنه أنا بعد الإجابة راح أقيم عن طريق DOI أشوف إنه الحكي هذا طالع من هذا الريسيرش أو لا.
كم خط يعني نكتب قد
يعني أقل من صفحة أو نص صفحة، إنه تحكي لي على الفالف اللوكيشن وتفصل بين يا تشامبر ويا تشامبر.
ترفع على جوجل كلاس روم؟
ترفع على جوجل كلاس روم إن شاء الله.
دكتور ناخذ أكثر من مصدر ولا مصدر واحد؟
مصدر واحد كلش كافي. In summary, and chest wall composed of vertebral column, the posteriorly, the sternum anteriorly, and we have 12 pair of ribs. 7 are true ribs, 3 false ribs, and 2 are floating ribs. While the muscles and the neurovascular elements are interposed between them. And we have the pleura, 2 layers of pleura, visceral and parietal. In between there is a small amount of fluid that allows smooth movement or action during the inspiration and respiration. The lungs composed of 2 lungs, right side 3 and left side 2. Both of them make 5 lobes. And the mediastinum composed of 4 parts: superior, anterior, middle, and posterior.
دكتور عفوا بس تقسيمات الربس قلت ترو فولس هاي شويه.
تمام. الربس we have 12 pairs of ribs. Okay, from right 12 and left 12, so 12 pair يعني 24 رب هو موجودين بكل شخص إلا إذا واحد شايل رب زايد. And we have the 7 of them. From the first to the 7, they are true ribs because they have attachment posteriorly to the vertebral column, anteriorly to the sternum. And we have the 3, which is 8th, 9th, and 10th. They are false ribs because they have posterior attachment to the vertebral column, but anteriorly they have attachment to the 7th rib, not to the sternum. Okay? They have attachment to the 7th rib. If they attach to the sternum, they are called true ribs also. So, because they don't have attachment to the sternum, they have attachment to the 7th rib, they are called false ribs. And 2 floating ribs, they have no attachment anteriorly. They have posterior attachment to the vertebral column, but anteriorly they are floating, so they are called floating ribs. So, I have a question. What are, apart from the protection of the thoracic cavity, what are the protection, what are the organs that the thoracic cage protect? Other organs that the thoracic cage protect?
Lungs.
Apart from the lungs, the heart, and the mediastinum with great vessels.
Vegas. Trachea.
Okay. Yes.
Other
Thymus
organs
gland.
like
Thymus gland. Within the abdomen.
abdomen.
Aorta.
Aorta within the abdomen, no. Within the chest wall, okay, yes.
Stomach.
Stomach. Liver.
Diaphragm.
The most organ predisposed to injury within the abdomen is the liver, because it's a big organ and located within upper abdominal cavity. So it's easy to be detached or injured, but the thoracic cage gives protection in part. But on the left side, we have the spleen. Yes, actually the spleen are protected by the thoracic cage. chest شنو الأهمية من دراسة الاناتومي of the thorax or the chest wall؟ احنا ليش بدنا نقراها؟ نشوف الchest خو نشوف الchest من برا وخلاص هذا هو نعوفه. لا, it's important because if we have faced a patient with RTA or pneumothorax or hemothorax or pleural effusion, we will need to insert chest tube. How we insert chest tube and when to insert it? This question, according to that, we will talk about where to insert the chest tube. So we have, this is the first rib, second, third, fourth, fifth. Okay? Between the fourth and fifth, we have this nipple. So according to this, we will calculate the fifth intercostal space at the mid-axillary line, which is imaginary line from the axilla to the superior iliac spine, mid-axillary line. We will insert it just anterior to the mid-axillary line. This will allow us to insert it safely, and it will face the space and doesn't cause any harm to the patient. If we took...
Pleura is a closed, serous, membranous sac into which the lung invaginates.
The chest tube will be inserted between...
There are two layers of pleura. The
This is
visceral and the parietal pleura.
The chest tube will be inserted between the visceral and the parietal pleura to drain the air or the fluid within it. No, it's chest tube. Chest tube underwater seal. And thank you for your attention. هاي التغذية الراجعة لتقييم محاضرتي، أتمنى أنه تمسحوها وتجاوبوا لي على الأسئلة لغرض تطوير المحتوى في المحاضرات القادمة إن شاء الله. وهذه المصادر مالتي Grey's Anatomy for Students 4th edition. هذه طبعا آخر إصدار من Grey's Anatomy. و Clinically Oriented Anatomy by Keith Moore 8th edition. This actually I have this book and I depended so much because it's very informative and give a lot of information within the pictures. Thank you for listening.